This podcast is on radiofrequency microneedle. Microneedle has been a hot topic in the last 2 to 3 years, really the last 2 years, and a lot of the trade convention shows have talked about the importance of microneedle taking over to help with acne scarring, to help with aging of the neck and skin. And I really have incorporated this into my practice now with great success. There's been a lot of variability with microneedle because microneedles by themselves, in my opinion, don't do very much. Partly because there's a lot of home remedies that don't go very deep, maybe about 1 to 2 millimeters. Mine goes much deeper because it's medical grade. That they don't go in spas, for example, down to about 3.5 millimeters. But the biggest difference is not that there's a microneedle, but there's a radiofrequency development. Without the radiofrequency element, the efficacy of microneedle is, in my opinion, very, very minimal. The RF unit that I use is actually vacuum seals the needles, pushes the needles in, and then heats up the dermis, protecting the outer epidermis. And so it's almost foolproof in terms of my staff doing it. And you cover the whole face. I've seen great results with minimal acne scarring. Now, what I mean by minimal, I don't mean the deep, deep pits, because the deep pits do get better with microneedle, but I've found microsilicone treatments to be far more effective. With the RF microneedle, for the residual that I have that are very superficial, the RF microneedle can further improve the deep acne scars, the more superficial acne scars, ones that silicone just really doesn't manage well. Besides acne scars, I do it for facial wrinkles that extend down the face that are hard to treat. I also treat that with meso-Botox therapy, but that can be more expensive, and the two together can work extremely well. So it's a great tightening for the skin with really minimal recovery times. In the face, oftentimes it's just a day or so. For the neck, sometimes you can have a little bit of discoloration without makeup for even a week. And it's safe in all skin types, which is really great. So I can do it in patients that are fair Irish skin all the way to Central African. So it gives me an option to treat Fitzpatrick 4, 5s, and 6s that I may not otherwise be able to treat with lasers. So RF microneedle to me now has become an integral component, not only to treat scarring, but also for skin rejuvenation for most of my patients.